Hello, everyone. Welcome to the workshop, Don't Drown in Debt. My name is Marcia Seligman, and I will be your moderator for this workshop. It is my pleasure to introduce Monica Fawzy Bryant. Ms. Bryant is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on healthcare-related issues. She is the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Ms. Bryant is co-author of the first and only book on cancer rights law and is an adjunct law professor at the University of Illinois at Chicago School of Law, teaching a class on cancer rights. Throughout her career, she has provided hundreds of educational seminars for individuals who have been diagnosed with cancer. Please join me in welcoming Ms. Bryant.
Thank you so much for that wonderful introduction and for the opportunity to spend a little bit of time with you all talking about dealing with debt, and more specifically, medical debt. So when we talk about a serious diagnosis, like cancer, for example, we know that debt is a very common byproduct, so to speak, of having to engage in the healthcare system. And if you are struggling with your finances, you are certainly not alone. In fact, 4 in 10 individuals report having medical debt, which is about 100 million adults in this country. So unfortunately, it is a very common problem. In the cancer community, there's been a term that's been used pretty frequently lately called financial toxicity. And financial toxicity really refers to the financial burden that often occurs after a diagnosis. And we've been talking about financial toxicity for years, and one of the reasons it is so challenging to address is that there are multiple contributing factors to this financial burden or toxicity that we experience after a serious diagnosis. At Triage Cancer, we believe the most significant contributing factor to financial toxicity is somebody's health insurance status. Now, that could mean not having health insurance at all, but more often what it means is someone doesn't have the right health insurance policy for them, or they aren't effectively navigating that policy. And so we have lots of resources on our website at triagecancer.org to help people pick the right plan and navigate those plans. Then certainly the employment changes that occur after a serious diagnosis could impact somebody's finances. And then all of the things that happen in life that may impact our finances, like relationship changes or moving, well, those things continue to happen even after a serious diagnosis, just further compounding the challenges. So while I'm not going to spend a ton of time talking about health insurance today, given that it is such a significant factor, I would be remiss if we didn't at least touch on it. One of the reasons that people struggle to find the right health insurance policy or to effectively navigate that policy is it's like learning a different language. But rarely are we ever taught that different language. We often say there should be a class in high school on health insurance and finances because we all have to deal with it. But too often we get this crash course once there is a serious diagnosis. So learning the language is incredibly valuable. And these are just some of the terms that are used related to the cost. So your premium is the amount that you have to pay every single month just to have health insurance. And you're going to use that amount, or you're going to pay that amount whether or not you use your health insurance. So you could have a plan with a $500 a month premium or a $2,000 a month premium, depending on your plan. Then there are additional costs that you will incur when you actually go and use your health insurance. So first is your annual deductible. This is a fixed dollar amount that you have to pay each year before your health insurance kicks in. And again, the amount of the deductible is going to depend on the plan. Some plans have a $0 deductible and they kick in on day one. Some plans have a $5,000 deductible, and so you have to pay $5,000 before the insurance company kicks in. When the insurance company starts paying, that is referred to your cost share or your co-insurance. And so these are two terms that actually mean the same thing. And this is always going to be presented to you as a percentage. So maybe you have an 80-20 plan. What that means is once you've met your deductible, the insurance company kicks in and pays 80% of your healthcare costs, and you're responsible for 20%. Now, there is often an additional payment called a copayment, and people often confuse copayment and coinsurance, and they're actually two different things. Where coinsurance is a percentage, copayments are a fixed dollar amount that you pay each time you get care. Again, these are going to depend on the policy. It could also depend on the service. So it's very common to have something like a $20 copayment when you go see your doctor, or a $30 copayment to see a specialist, or a $250 copayment if you go to the ER. But it's always going to be that fixed dollar amount. Now, one of the most important things we all can know about our health insurance is what is the out-of-pocket maximum. This is a fixed dollar amount that is the most we should pay out of pocket for our health care in the year. Once you meet your out-of-pocket maximum or hit your out-of-pocket maximum, the insurance company kicks in and pays 100% of your expenses for the rest of the year. Now, the details here do matter. So different plans have slightly different definitions of out-of-pocket maximum in terms of how you get to it. But if, for example, you have a plan through the marketplace, the way that the out-of-pocket maximum is met is by adding up everything you pay towards your deductible, everything you pay towards your copayments, and everything you pay towards your coinsurance. So it's everything you're paying out of pocket except those monthly premiums. So to give you an example of how this all works, meet Dan. Dan has a plan with a $2,000 deductible. It's an 80/20 coinsurance, and it has an $8,000 out-of-pocket maximum. Dan hasn't gone to the doctor at all this year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan have to pay? Well, the first thing we always have to pay is that deductible. He pays his $2,000, and we subtract that from the bill, leaving $100,000 left. He's met his deductible, and so now the coinsurance kicks in, and the insurance company pays 80%, and Dan pays 20%. 20% of $100,000, $20,000. But does Dan have to pay that full $20,000? The answer is no, and the reason for that is that out-of-pocket maximum. So how much does he actually have to pay? He has to pay another $6,000 because he's already paid $2,000 in the deductible. So once he pays another $6,000, he meets that out-of-pocket maximum, and the insurance company pays the rest. Now, I am not at all suggesting that $8,000 isn't a lot of money. Of course it is. But when we start thinking about what our expenses would be without these out-of-pocket maximums, it's certainly better than $20,000. And even the $8,000 is better than the $102,000 someone might have to pay if they were uninsured. So understanding how all of this works is a critical component to minimizing potential medical debt. Now, another challenge is sometimes there are terms that are used interchangeably that aren't interchangeable, and this is an example of that. So balance billing is when someone chooses to go to an out-of-network provider, and the insurance company pays, let's say, 50% for an out-of-network provider. That out-of-network provider is allowed to turn around and charge the patient the other 50% because that person chose to go to an out-of-network provider. But if they go to an in-network provider, then that provider has to accept whatever they agree to accept from the insurance company. They can't bill the patient for the rest of it. Now, that's very different from surprise billing, which is where you do your due diligence and you think that you have gone to an in-network hospital and seen in-network providers, and then you find out that somewhere along the way, someone wasn't in-network. And this is very common in surgery, for example, when you find out after the surgery that the anesthesiologist wasn't in-network. That is what's referred to as a surprise bill. And over the years, states had started to pass state laws to help protect patients against surprise billing. But the good news is that as of January 1st of last year, we now have a federal law that protects patients called the No Surprises Act. And basically what the No Surprises Act says is if the person has done their due diligence and it literally is a surprise that someone ended up out of network, then the insurance company and the provider have to negotiate how the payment is going to happen. It's treated as an in-network provider with respect to the patient. So I bring this up as a discussion around medical bills because if you receive a big bill that is a surprise in terms of, wow, I thought this person was going to be in network and now they're telling me they're out of network and they're making me pay 100%, there is a No Surprises help desk. You can call them on the 1-800 number, or you can fill out a form online, and I've given you both of those on the slides. And the No Surprises help desk will literally help you figure out how to deal with this surprise bill. And even though this law is over a year old, there are lots of people that still don't know about it. Now, in addition to making sure we understand our health insurance and how it all is supposed to work, we can actually make choices each year to potentially minimize our future medical bills. And so understanding what all of our options are is a really valuable piece of this medical debt puzzle. Now, generally speaking, there are certain times of the year that we get to enroll in health insurance, and it depends on the type of health insurance that somebody has. We do have more information about all of these different enrollments for the various types of health insurance on triagecancer.org. And having all of these different options is fantastic, but how do we actually make choices between those options? I'm going to walk you through a quick example of how you can compare two plans sold in the marketplace, how you can compare between potentially two plans that are being offered by an employer, or let's say you're trying to decide, do I take my employer plan or buy a marketplace plan? Or even if you're trying to decide between two Medicare Advantage plans. The exercise I'm going to give you works in all of these different situations. So here we have three different health insurance plans. We have the first plan with a $200 a month premium, a $6,000 deductible, and an $8,000 out-of-pocket maximum. We have a silver plan with a $275 a month premium and a $2,500 deductible and a $6,000 out-of-pocket maximum. And then a platinum plan at $400 a month with a $2,000 out-of-pocket maximum. So if I'm trying to figure out, well, how do I potentially pick a plan that is going to minimize the chance of medical debt, right? So I'm assuming I have a serious medical condition, I have a lot of medical bills, I'm going to hit the out-of-pocket maximum, which is the case in many of the circumstances you all may be in. How do I pick a plan that's going to cost me the least? Can I just look at one of these columns? Can I just look at the monthly premium? And the answer is no. But what you do have to do is the math. And the way you do the math is you take the monthly premium and you multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you add the out-of-pocket maximum. And when you do that for all three of these plans, it turns out that that platinum plan ends up being significantly cheaper at the end of the year. The challenge with this is many people only look at that monthly premium and they get a little bit of sticker shock thinking, well, why am I going to pay twice the amount at $400 a month when I can only pay $200 a month? And the difference is really the total math here. So it's important for people not to get that initial sticker shock from the monthly premium. But of course, that total cost is only one piece of the puzzle. You do also want to consider the co-payments, the deductibles, because maybe it's two plans are very close together and one has a $5,000 deductible and one has a $0 deductible. Well, that means that the $0 plan kicks in on day one. Even if you find the most affordable plan, you need to make sure that that plan includes your providers and any facilities you use in their network. Because picking the most affordable plan that doesn't have any of your providers in it isn't going to be helpful. And the reason for that is that most of the time, the out-of-pocket maximum only includes payments made towards in-network providers. Similarly, you need to make sure any prescription drugs that you're taking are included in that plan's formulary, which is the list of drugs that that plan is going to cover. I often say to people who have complex medical situations, it's even helpful to ask providers, listen, I know what drugs I'm currently on, but are there any medications that you foresee I could potentially need to take in the next year? And that's helpful because you can actually make sure that all of those potential medications are on the formulary as well. Now, I know that this is a lot of information in a short period of time, so I want to point you to two specific resources. The first is one of our animated videos that's about 5 minutes long on how to pick a plan, and it goes through the example I just gave you. The other is an actual worksheet that you can print out, and it prompts you to fill in the important information, and it helps you actually do the math to compare two plans. Both of these resources are available for free on triagecancer.org. But even if you have the best health insurance that exists, there are still going to be medical bills. So what do we do about those? Sometimes bills can even be reduced before you receive care. And the first step in this process is making sure you're communicating with your healthcare providers about costs. For some reason in this country, it is not customary for us to talk about costs with our healthcare team. And we think that that needs to change because just starting the conversation makes the healthcare team aware that you are in fact concerned about the cost. Now, there may also be some other people who you aren't currently seeing on a healthcare team that could be helpful, like a social worker, a navigator, or a financial counselor, because there may be other programs you're eligible for at the hospital, like ability to pay programs that provide discounts or financial assistance. So there are some resources out there for you. Now, if you know, for example, that you are going to an out-of-network provider, and that happens occasionally for a number of reasons. So maybe you need surgery and there is a surgeon that specializes in your diagnosis, but they're out of network. You could potentially negotiate with that provider before you even receive services. And there's lots of things you could ask for. A payment plan, you could potentially ask them to charge you what they would have charged someone who was in network, which is always going to be a discounted rate. It could also be about arranging independent lab work. So sometimes you might be seeing a doctor in a hospital facility, and the lab that is in that hospital facility isn't in your network. Well, if the doctor sends you down to that lab because it's convenient and you know it's out of network, then you are going to pay more for that lab work. So sometimes you can figure out, oh, well, this lab isn't in my network, but the one down the street is, so I'm going to go get my blood work done there and have the results sent to you. Similarly, the same kind of idea works for other tests too. So I know where I live, if you are to get an MRI in the hospitals, it is typically more expensive than if you go to a standalone MRI imaging facility. So Healthcare Blue Book is a really great tool to shop around and see what the estimated prices are before you get those tests. Sometimes it's helpful to group follow-up appointments if possible so that you're only paying one copayment as opposed to multiple copayments. And sometimes it may be that there are less expensive generic versions of medications or treatments. Now, I am, of course, not suggesting that someone take a less effective medication just because it's less expensive. But if you have a conversation with your healthcare team and they think that it is appropriate, that is an additional way to save money. Now, once you receive care, you're going to get many pieces of communications. So just from the health insurance company, you could potentially get a letter that says, we've gotten a claim. Then you could get another communication saying, we're processing your claim. And then finally, you're going to get something called an explanation of benefits, or an EOB. And the EOB is incredibly important to take a look at. This is what we think is sort of a gold star version of an EOB. And the telltale sign is somewhere in big black letters, it's going to say, this is not a bill, because it's not a bill. It's the health insurance estimation of what you are going to be responsible for based on where you are in the year in terms of meeting your deductible and your out-of-pocket maximum. Some other information is going to be about the policyholder and who the patient is, if it's a family plan, a summary of how much was billed, how much is the health insurance company going to cover, and then how much are you responsible for. Then down below, there should be some detailed information with dates of the different services and what's included in this EOB. Now, I have to tell you, many EOBs do not even include words in this section. It's just this code, and you have to figure out what that code is. So that can be challenging. It should also say, well, how much was charged by the provider? How much is the allowed amount, which is the agreed amount that the provider and the health insurance company agreed to previously? And then how much are you responsible for based on where you are meeting your deductible and your coinsurance? Now, a great EOB would also list how much you've paid for the year towards your deductible and your out-of-pocket maximums. But not every EOB has all of this information. And the last piece of communication you're going to get is from the provider themselves. So this could be the doctor, the hospital, the lab, the imaging center. The challenge is that it doesn't always happen in this order. Providers are often faster at sending people the bill than insurance companies are at processing the claim. So it could be that you get a bill first and you look at it and you go, oh my gosh, that's a lot of money. But if you haven't gotten the EOB yet, you should not pay that bill yet. Because what that means is that the provider is essentially billing you for the full amount. They haven't taken into consideration what the insurance company is going to pay yet. So again, the rule of thumb is wait until you receive the EOB before you pay any bills. Now, this shouldn't happen in a vacuum, because if you get the bill and you think to yourself, well, I haven't gotten my EOB, I'm not going to pay it yet, but you never communicate that to the provider, from the provider's perspective, you're just not paying your bill. So what I recommend is that you call up the provider and you say, just wanted to let you know I've gotten this bill, but I haven't gotten my EOB yet. It doesn't look like insurance has processed it. Can you please push back the due date and make a note in my file that I'm waiting on the EOB? In my many years of doing this, I have never heard a provider having an issue with this. So when you get that EOB and the bill, we actually, as healthcare consumers, need to be checking to make sure it's accurate. Medical billing is a human process, and humans make mistakes. And they're about, I think the last study I saw was 80% of all medical bills contain at least one mistake. So we do need to be making sure that we are being billed for everything that we received, that all the numbers are accurate. You know, I've seen crazy stories where someone's billed for 11 surgeries instead of one because someone accidentally hit the one twice. So making sure that everything is accurate on the EOB and that the EOB and the bill match is very valuable. For someone who's had a complicated medical history and this process might feel very overwhelming, there are professional bill reviewers that you can hire to help you navigate this process. And if you receive a denial from the health insurance company, know that you do not have to take no for an answer. As consumers, we have the right to appeal denials from our health insurance company. Now, the details definitely vary from plan to plan, but generally speaking, for somebody who has an individual plan that they've purchased themselves or one they get through work, there are going to be at least 2 levels of appeal. The internal appeals process is where you go back to the insurance company and you ask them to reconsider. And if they still say no, then you have the right to something called an external appeal, also known as an independent medical review. And this is where you go to an independent entity, and that entity looks at the plan, looks at your medical history, looks at the claim, and makes a decision as to whether or not receiving that service was medically necessary. A couple of things to note here about appeals. First is that it is something that you can do if you've asked for a prior authorization before receiving services and been denied. You can appeal at that stage. You can also appeal if you've already received the service and been denied. The second piece is this is absolutely an added burden on patients and their families. It is a hassle. It is more to add to your plate. 100%, I agree with that. However, it is often worth your while to add this to your plate and appeal denials. The exact number varies based on the type of insurance, but about 40 to 60% of all appeals are decided in favor of the patient. I'm going to say that one more time. 40 to 60% of appeals are decided in favor of the patient. So when somebody gets a denial, we think it is worth your while to appeal that denial. But there are a number of hurdles in this appeals process, and one of them is you're adding more to your plate, and it's a lot to handle, and it's a lot to kind of keep track of and stay organized with. There's potentially going to be conversations between providers and health insurance companies and maybe pharmacies. So you have to keep track of every phone call you have, the names of the people you talk to, the summaries, the action items. Do you have to send something? Are you expecting something in the mail? And so because it's a lot, we don't recommend the Post-it note method of keeping notes because inevitably you lose that one really important Post-it note. We have a appeals tracking form that you can download off of our website to just help you stay organized in keeping all of this information. One of the reasons I think this tracking form is really helpful is that because there are blank spaces in there, it's sort of a prompt when you're on the phone to remember, oh, I need to get that person's name. Oh, I need to remember to ask them when I can expect to get whatever in the mail. So it's just a useful tool. This process is also a wonderful time to engage family and friends. So, you know, that really good friend of yours that says, I'm so sorry you're dealing with all of this. Let me know if there's anything I can do to help. Fantastic. You know what you can do to help? Sit on the phone with me and you please take notes while I just have conversations with the insurance company and the providers. So first hurdle is staying organized. Second hurdle is it's not always clear what stage of the appeals process you are currently in. Insurance companies employ a tactic called peer review. And this is where you have the health insurance company hires a healthcare provider, a doctor, let's say, and that doctor is now talking to your doctor about the service and why it was necessary. In theory, this sounds great. 2 people having a conversation, we can clear up this whole situation. The challenge, though, is that many times the doctor that the health insurance company hires is not of the same specialty as the prescribing doctor. So you could have a retired OBGYN talking to someone who's, you know, up on the latest in precision medicine, for example. So there's a knowledge disconnect. The other challenge is that sometimes these peer reviews are sort of presented to patients as if it's the same thing as an external appeal. And it is not. It is just another level of internal appeal. And then finally, the last major hurdle with respect to appeals is knowledge. Too many people don't know that they have the right to appeal. And when we just look at individual policies, 48 million claims were denied in 2021. 48 million claims were denied in 2021. 99.9% of those denied claims were never appealed. But remember I said about half the time when the insurance company says no, they're getting it wrong. Yet 99.9% of denied claims aren't getting appealed. And so when we talk about medical debt, this appeals process is vital to avoiding medical debt. And it's so important, and it's such a soapbox issue for us. We have a number of free resources available on our website to help you navigate the appeals process. Everything from a quick guide to a short little animated video to a 90-minute long webinar that gets into the weeds of all the things. So please, if you've received a denial, take advantage of those free resources. Now, if you haven't gotten a denial, but you just don't have the money to pay the bills, you have to negotiate. And the key to successful negotiation is timing. So making sure that you are negotiating before the debt is sent to collection agencies, because once it's sent to collection agencies, it gets much more challenging to come up with solutions. And there's a number of things that you could potentially ask for, like more time or a payment plan, or maybe even accepting a lower lump sum payment. This works with all different types of creditors, not just healthcare providers. Now, we do have a little bit of good news with respect to medical collection debt and how it impacts your credit score. The three major credit bureaus have recently said that they're going to start treating medical debt differently than they treat other debt. So once medical debt gets paid, it's no longer going to be included on your credit report, and you're going to have more time to pay that medical debt before it hits your credit report. We're also anticipating an announcement any day now that says debt that's under $500 is likely not going to be reported on credit reports at all anymore. So some small good news there. Now, when you are thinking about dealing with your medical debt and your financial information, it's important to stay organized. There's a lot of pieces of paper. There's a lot of moving pieces. And generally speaking, that is not a good organizational system. So what is? It doesn't matter. File folders, 3-ring binders, electronic files. There are some pre-built planners that you can pay for that sort of help you stay organized. The best organizational system for financial information is one that you are going to be able to maintain. So whatever makes the most sense for you in other areas of your life is something that could be helpful for you here. And if staying organized is a challenge that you're having, we have a couple of webinars that give some very practical, easy to implement suggestions on how to stay organized. But specifically with respect to medical bills, we've created a bill tracking sheet. It's a spreadsheet that could be Excel or Google Sheets or numbers, depending on your platform that you use. And what's really helpful about this worksheet is that you can put in information about your insurance policy. So how much is the deductible? How much is the out-of-pocket maximum? Then as you start getting bills, you add it to the bottom, and the system, the spreadsheet, will start deducting amounts about how much you have left to meet your deductible and how much you have left to meet your out-of-pocket maximum. So this worksheet is particularly helpful if you have an insurance company that doesn't have a great EOB and keeps track of this for you. And one of the reasons it's so valuable to keep track of all of those expenses is that some of those expenses could be tax deductible. Of course, we just closed tax time for this year, but if you haven't filed your taxes yet, you could potentially still get an extension, And if you are struggling to figure out how to file your taxes, there are a number of free resources that will help you, including the Volunteer Income Tax Assistance Program. Now, when we're talking about dealing with medical debt, creating a budget and making sure that you're allocating the right amount of money to pay that debt down is helpful. But creating a budget is one of many things that I say that is easier said than done. And so there are some organizations out there that provide free help. So credit counseling agencies are a great solution. And there is a national foundation for credit counseling where you can put in your zip code and find someone local to you. Also, financial planners can be very helpful. There is a misconception that financial planners are really only helpful if you have a ton of money, when in reality, a lot of financial planners sort of help people who might be considered middle income, although I don't really know what that means anymore, but it helps them not experience huge amounts of debt or challenges with their credit. Financial planners charge in all different ways. So sometimes they are hourly, sometimes it's like a contingency basis, sometimes they're free because they're hoping that you're going to buy another service from them. So the Financial Planning Association is a good place to start to look for financial planners. But sometimes there just isn't enough money to go around and you need additional help. And that's where I would point you to financial assistance. On our website at cancerfinances.org, we have a module on financial assistance options. And in that module, there are going to be local, state, county organizations. There's going to be cancer healthcare organizations that have different financial assistance programs. There are private programs that can help. And so it's based on category. So you would go to cancerfinances.org, and then you'd select the category you need help in. One thing I do suggest, however, is that you think creatively when thinking about financial assistance. Sometimes people will come to me and say, well, I really need help paying my copays, but I can't find help doing that. So then what I might suggest is, well, is there other types of financial assistance like utility assistance that you are eligible for? And then if you get that utility assistance, you can then shift those funds over to help pay for your copayments. Now, another area where people often struggle is to pay for their prescription drugs. Most pharmaceutical companies and specialty pharmacies have assistance programs, and the assistance programs certainly vary and have different eligibility requirements, but they do more than just provide copay assistance or free drugs. They often have resources to help with prior authorizations or appeals. Sometimes they're able to connect you to other types of assistance, like help with transportation or lodging, for example. And so on cancerfinances.org, we actually have I know it's a little hard to read, but we have this tool that lists some of the major pharmaceutical companies and the various programs that they have. You can search this tool by your prescription drug name or by the company name, and then you'll see what type of assistance. Is it co-payments? Is it free drugs? Is it other types of assistance? And then there's a link specifically to the application process there. Now, another tool is potentially you may have access to lower cost drugs through a partnership that we have with Needy Meds, another nonprofit. We have this drug discount card that you can download off of our website, and you can take to your pharmacist and ask, what would my prescription cost if I were to use this card versus going through my insurance? And it may be that you get a discount using this card, but really what this card is helpful for is that it starts a conversation between you and the pharmacist. And it lets the pharmacist know that you are concerned about the cost of your prescription drug. And they may even say, well, you know what, your prescription isn't on this discount program, but I know of this other discount program that you can use. Now, this card, there's no registration, there's no fee. One card can be used for the whole family. You can print it out and hand it to your neighbors. There is no sort of registration involved in using this card. Now, in my last couple of minutes, I want to just talk about some other programs that aren't really related to your medical bills at all, but again, might be helpful if you are struggling financially. So TANF is Temporary Assistance for Needy Families, and it does provide limited cash assistance to individuals who are eligible. Many times, if you're eligible for one type of program, like Medicaid or SSI or SNAP, which is food benefits, you'd be eligible for other types of benefits like TANF. But sometimes you have to ask for those benefits. If you are struggling with food insecurity, which has unfortunately become incredibly common post-pandemic, there are a few different resources. So the USDA National Hunger Helpline can help connect you to local resources. SNAP is the program that used to be referred to as food stamps, but it really is the Federal Nutrition Program. For women and children, there are different programs. And then for seniors, there are two federally sponsored programs that are really targeted at helping seniors get high quality food. There may also be help for your rental or housing costs. And as I mentioned, there might be utility assistance. There is a federal low-income home energy assistance program, or LIHEAP, and there is an equivalent to help you pay for clean water costs. There are also some programs to help you access either a cell phone or broadband internet. There's two different programs, and I've given you the links here. And so when I talk about thinking creatively, this is really what I'm talking about. So looking at all of these different programs that you might have access to so that you could potentially shift around funds. But we know that it is not always easy, and it's overwhelming, and every program has different eligibility and applications, and it literally could become a full-time job. I completely understand. We have a quick guide, or excuse me, a checklist to finding financial help that tries to streamline this process for you. Now, I'm going to open it up to see if there's any questions in just a minute, but I do want to let you know that if you're interested in learning more about these topics, whether it's health insurance or employment or disability insurance or estate planning, Triage Cancer has a number of both educational events and free resources on our website. All you have to do is register for the events on our website. We also have the opportunity for you to get one-on-one assistance through our legal and financial navigation program. So anyone is welcome to fill out the form on our website at triagecancer.org/gethelp. You'll get an email back with a link to schedule an appointment with us, and then we get on the phone with you and we answer your questions and we explain your options and we give you the next steps to take. And we often get questions, if someone doesn't have a cancer diagnosis but has a different serious medical diagnosis, can they use this program? And the answer is yes. Certainly we have capacity, but we will never turn someone away simply because they don't have a specific cancer diagnosis. So I just wanted to end with that so that if you have questions that don't get answered today or questions that come up in the future, you know that in addition to BMT InfoNet and all their phenomenal information, Triage Cancer can also be a resource for you in the future. So with that, I will turn it back over to see if there are any questions.
Thank you so much for this very informative presentation. We will now begin the question and answer session. If you have a question for Ms. Bryant, please use the chat box on the left side of the screen to submit your question. We will answer as many questions as possible. The first question is someone would like to know that if you can appeal a denial of a claim even though you've already paid the bill instead of appealing it.
Potentially, yes. There are timing requirements with respect to appeals. So generally speaking, you only have 180 days from the claim denial to submit your appeal. But if you're in that 180 days, you could still appeal to the insurance company. And if the insurance company approves your appeal, then basically they would pay the provider and the provider would end up refunding you.
Okay, the next question asks, my employer is trying to terminate me while on long-term disability, and I may lose my health benefits. Is it their right to terminate? And do you have any recommendations of how I should move forward to make sure I get the coverage I need?
So that would be a presentation all in itself. But what I would say is a couple of things. So long-term disability insurance policies are about payment. They're about money because you're not able to work due to your disability. There is no job protection associated with that. Usually what happens is someone receives leave through the FMLA, which is job protected leave. But FMLA leave only entitles you to 12 weeks of job protected leave. And so in many circumstances after those 12 weeks, barring some other program, if you aren't able to return to work within a reasonable amount of time, then the employer can in fact let you go. I would, of course, want to ask a whole bunch of other questions of you specifically, whoever asked the question, so that might be something I would refer you to our legal and financial navigation program for. But I will also say that if you do get terminated and your concern is around health insurance, you could have a number of options. So if you work for an employer with 20 or more employees, you could have access to COBRA to continue your existing health insurance. You would also have a special enrollment period into the marketplace to purchase a totally new plan, because you could potentially also get financial assistance to do so. Based on your income level, you might have access to Medicaid. Based on your age, and if you're receiving SSDI, you might have access to Medicare. So as you can see, there are a lot of moving pieces, and we would need some more information to be able to provide you with your specific next steps.
Okay, someone would like to know if postage paid for medicine counts against out-of-pocket expenses.
Postage paid for generally, no. If you mean your out-of-pocket maximum, then likely no, because it's going to be deductibles, co-payments, and co-insurance.
Okay, I keep hearing about co-pay accumulator. How would you address this?
So this is an ongoing issue where essentially, and I'm going to oversimplify for the sake of time, but essentially what it is when people receive financial assistance from a pharmaceutical company for their prescription drugs, insurance companies are now saying that they aren't going to count that assistance towards somebody's deductible or out-of-pocket maximum. And so basically, the arguments against this is that insurance companies are essentially double dipping. They're getting paid by the pharmaceutical companies, but then they're not passing on that benefit to the patients. It is certainly an advocacy opportunity. So if you are an advocate at heart and want to address this, it is something that you could be talking to your elected officials about. Because it is very challenging for a lot of patients. But as of right now, it is acceptable.
Someone would like to know about what they could do if they cannot afford a treatment.
So I think, again, it's really hard to talk about that generally. I would want to know what the treatment was and why can't you afford it? Is it because you don't have health insurance? And then potentially we could figure out if you have access to health insurance. If it's that it's an out-of-network provider, could you find an in-network provider that could provide you the treatment? If it's a prescription drug, is there a pharmaceutical assistance program? So I think what I would say, again, is I would need more details in order to be able to effectively provide useful suggestions.
I have a lot of bills that are building up. What are the bills I should pay first?
So that is a really common question, and again, one that can't be answered in the abstract. So if someone is trying to figure out, well, what do I pay first and how do I deal with this, I think that is exactly where a consumer credit counseling agency can be helpful. because they can look at your exact situation. You know, how much income are you bringing in? What are the sources of income? What are the various sources of bills or debt? And then figure out, you know, okay, you need to pay the minimum due here versus, you know, a lump sum here. But then it's also about negotiating. So if someone is getting multiple medical bills, going back to those providers and asking for more time or asking for a payment plan can be very, very impactful.
If you get terminated from your job, does your long-term disability also get terminated?
If you are talking about a private long-term disability plan, generally no. The details do vary from plan to plan, but the whole idea behind the long-term disability plans is that they're making up for a percentage of your income that you've now lost because you can't work due to your disability. So the idea behind them is even after you don't have a job anymore, they will continue paying. But every policy has a different set of rules. So some long-term policies say, you know, we're only going to pay you out for a year. Also keep in mind, if you have a private policy, that many of them will require that you apply for Social Security Disability Insurance, or SSDI. And that's the federal long-term disability insurance program. It's very, very common. And basically what happens is if you get your SSDI, moving forward, your private policy is prorated. So if you get, you know, let's say 90% from your private policy and SSDI is going to pay you 50%, you don't get to get more than 100% of what you were making when you were working. It gets prorated. So SSDI pays 50% and the long-term pays 40%.
Now that I'm going through treatment, can I change my insurance so that I have a lower out-of-pocket maximum?
It depends. So it depends on where you receive your insurance and what time of year it is. So if, let's just say, you have a plan through the marketplace, there is an annual open enrollment period in the fall, and that's when you can make changes for the next calendar year. So you would potentially make a change in November, you'd pick a new plan with a lower out-of-pocket maximum, and that new plan would kick in January 1st of next year. Just getting diagnosed or needing a bone marrow transplant does not give you the opportunity to switch plans mid-year. That being said, employers, if you get your insurance through a job, they can pick their open enrollment. So sometimes they're on a fiscal year or June to June year. So it just depends on when their open enrollment is. But outside of open enrollment or another major life change, like moving to a new state or losing your job, you're not going to have a special enrollment period to change mid-year. But when we talk about medical debt and avoiding medical debt in the future, what you're asking is exactly the suggestion. So even if you don't have a great plan right now and you're going to incur higher medical bills, can you make changes for the next calendar year that minimizes those bills moving forward?
Okay, we are running out of time, so this is going to be our last question, but someone asked about not having insurance and they need a transplant. What do they do?
Reach out to us so that I can ask you some more questions, or one of our staff can ask you some more questions so we can figure out what your potential insurance options are, if any, because it's going to depend on a lot of factors like what state you live in and what your income level is and your household size and where you're receiving treatment. So all of those factors are going to play into what your potential health insurance options might be. So please reach out to us.
Well, on behalf of BMT InfoNet and our partners, I'd like to thank Ms. Bryant for her very helpful remarks, and thank you, the audience, for your excellent questions. Please contact BMT InfoNet if we can help you in any way. Enjoy the rest of the symposium.